Welcome to the FLOM Leadership Academy podcast series, generously supported by CooperVision. Hi, my name is Elizabeth Wyles, and today we have here Dr. Linda Casser. She's a dear friend and colleague who has dedicated her professional life to optometry. Her name is synonymous with excellence in professional leadership, and particularly in the educational arena. Dr. Casser, you recently retired from an illustrious academic career spanning over 40 years. You started as a faculty member shortly after completing a residency, then became involved in academic administration, which ultimately led to being the dean of the Salus University, Pennsylvania College of Optometry. Along the way, you've served on countless boards at the state level, national level, and internationally. All these achievements have been recognized with countless awards, and just to name the two most recent, the AAO Hall of Fame and the Lifetime Achievement Award from the Indiana Optometric Association. So welcome, and thank you so much for spending your time with us today.
Thank you.
As you look back, are there any specific moments that you see that were pivotal in your professional success?
Well, first of all, thank you for your wonderful introduction and for including me in this wonderful podcast series. I would say, like a lot of our colleagues and a lot of us, my residency program was pivotal. Wonderful two-year program, one of the earliest in our professions, under the direction of Dr. Lou Catania. It was outstanding clinically, affiliated with SUNY College of Optometry. Dr. Erwin Suchoff was a wonderful residency director. And the faculty of the program, Lou Catania, Dr. Murray Fingerette, Dr. Barry Thorne, Dr. Ted Woodcomb, not only outstanding clinicians and educators, but wonderful mentors, and truly helped my career in so many ways and became dear friends. So it's hard for me to imagine what my career would have been like having not done that program, but just truly fortunate to have the personal and professional experience in having done so.
As you mentioned, it was one of the earlier residencies, and what prompted you to do a residency? Because at the time, one, there weren't very many, and it was, generally speaking, a new concept.
Yes. I believe there were only 3 residency programs in our profession at that time. I believe the vision therapy program at SUNY was the first, the VA program in Kansas City, the second, and I believe this was the third. So I was always interested in learning, and I felt I wanted to learn more, especially clinically. I was one of the earliest students to do a rotation at a VA. I was at the Cleveland VA for 6 weeks, the summer between my 3rd and 4th years. And that really sparked my interest in learning more from a clinical standpoint and applying what I had learned didactically. I also wasn't sure where I wanted to practice geographically, so decided to apply for the residency program and was fortunate to be accepted.
And you chose to do this also during a time of a lot of change to the profession with the expansion of scope. Is that not correct?
Yes. Well, I'm sure we all know Dr. Lou Catania, Dr. Murray Fingerette have been wonderful clinicians, role models to help change the scope of our profession. Back then into therapeutic pharmaceutical agents. So once I finished my program, and again, thanks to their mentoring and championing the success of my career, I had a number of continuing education lecture opportunities to hopefully help expand scope of practice in different states all around the country. I also had an opportunity to lecture internationally when colleagues in Australia were expanding their scope of practice.
Okay, so I hear you had obviously a number of opportunities to be involved to some degree in scope expansion, and I feel like that's kind of happening again. And so what are your thoughts on the current expansion of scope? Particularly this year here at Academy, we have the laser course and the minor surgical procedures course, which is linked to skills transfer. What are your thoughts on scope expansion today as compared to what you experienced previously?
Well, after finishing my residency in a faculty position at PCO, I was at my alma mater, Indiana University, And we were writing the second edition of our Atlas of Primary Eye Care Procedures. Marie Fingerette was the primary on the first edition. I was the primary author on the second. And I spent a month at the Oklahoma College of Optometry doing injections, suturing, and lasers. So our second edition, which came out in 1997, included those procedures. So as a profession, we need to function as a profession and always look at the future and what's best for our profession, what's best for the patients that we serve. So I am fully in favor of whatever makes sense as a profession to expanding our scope, pharmaceutically, procedurally, et cetera.
Also, as I look back at your time early in your career, I will generally state that there weren't a lot of women at the table. And what was your experience with that?
Well, I wasn't among the very first, but I believe it's fair to say I was among the early wave of women in our profession. So I was in the class of 1978 at IU School of Optometry. There were 15 women in a class of 65. Interestingly, I was at a symposium on Tuesday, and there was a statistics shared that right now in our profession, 48% of our profession is women. Back then, it was 2% women. So interestingly, I didn't think much about gender issues at that point. It took me quite a few years to realize that other folks did think more about it specifically, and I believe it's fair to say that I was a role model for female colleagues in the sense of medical optometry, continuing education lectures, administration. But interestingly, as I applied for the residency program, someone said to me, this is a direct quote, "I'm not sure a woman can handle being a resident." I thought, well, that's interesting. I thought, okay, well, thank you for sharing. I sort of didn't let it faze me, but it was just sort of interesting to run into those types of perspectives at early points of my career, and really through the mid of my career, I would say.
And as we jump forward to today, inclusion is much broader today, and
Yes.
we have all been working very hard to be all inclusive. And what are your thoughts about that in comparison? Because I see a lot of repeated themes here, but in a broader scope.
Yes, full agreement. My generation, it was a gender issue and inclusivity of genders. And happily, again, had wonderful male mentors who realized the importance of being more inclusive from a gender perspective. But yes, absolutely, now we need to go way beyond gender and fully in favor of it and really applaud the initiatives that have taken place within our profession. We need to reflect the population at large in our profession, and also we need to ensure that our patients feel comfortable under our care.
I believe, I'm going to put some words in your mouth.
Okay.
I believe you would agree that leadership is a journey. And it's something we must dedicate ourselves to over time. And we have to learn from our mistakes. And we have to learn from our successes. Can you share a mistake that was particularly helpful with your development as a leader? And can you share a success that was particularly helpful with your development as a leader?
I'd say definitely not just one mistake, but there is a mistake I would like to highlight for sure. I've been fortunate, or I had been fortunate through my career to be affiliated with different institutions, and those obviously involve geographic moves, but organizational moves. And I'd say a definite mistake that I try to share with others when I have opportunity is that, especially early on, I did not appreciate the importance of organizational culture, the way an organization does its business. That can be formally articulated, it can be informally implemented. And there were times when I made assumptions that were not good assumptions, or I did not take the time to learn the organizational culture of the culture of the organization. I think happily, as the years unfolded, I realized that importance, but I would say that was a definite mistake for sure. Happily, I believe there were some successes, and one that comes to mind for me, which I think we've shared over the years, is communication. I always tried to give a lot of care and thought to what I communicated and how I communicated. And if I could share a quick anecdote, when I was Associate Dean at Pacific University College of Optometry, when we first crossed paths, when I was a new Associate Dean and I made the switch from clinic education and clinic administration to academic administration, which was a big move career-wise and geographically, I was crafting my first memo to the faculty at the college. Now back then that was duplicated memos put in mailboxes. I spent hours thinking about what to say as the new Associate Dean, how to say it, and then distributed the memo. So fast forward several years, a la the Mert Flom Leadership Series, and had the opportunity to be one of the workshop lecturers, and I shared that anecdote in the communication module. And I said, I probably spent way too much time on that memo, and one of the participants in the course said, no, you didn't, which I really appreciated. So again, to recap briefly, I'd say missteps definitely when I did not take the time or understand the importance of learning organizational culture, and then hopefully making positive efforts to communicate in a positive and effective way.
And I can speak to that when I was at Pacific with you, your communication was always very clear, and I would say you were a role model for that for us to pause, and as we sent emails to our colleagues and communicated. So I will say I thank you for that.
Well, thank you.
What advice would you give junior faculty just beginning their careers in optometric education?
Several thoughts. First of all, to realize what an important role it is and how impactful it is in ways sometimes we don't even appreciate. Like, I'm sure, Liz, you've been at this meeting, and I have students from years back coming up to me saying hello and fortunately thanking me for having been one of their faculty members. And you mentioned the role modeling role. To me, that's all important, how other people view you. And sometimes we don't always realize when and how that happens. So to me, again, we have professional sides, personal sides, but I think it's so important as professionals and faculty to role model excellence and quality. So again, my first piece of advice to young faculty, realize it is an important role, it's an impactful role for students, colleagues, staff, patients, and patient family members. Secondly, I would say make full advantage of it. I loved my career in optometric education because of the opportunities it provided. Usually there are expectations of teaching, scholarship, service, but how we pursue those and the opportunities we have can be so diverse and so invigorating. And I'm truly fortunate, as you were kind to mention, to have had just some wonderful opportunities, and still to this day, and resulting in career-long friendships with just wonderful people. And then I think the third thing I would say, which has been an initiative through ASCO, the Summer Institute for Faculty Development, I was fortunate to be part of that initial working group, is to understand how to be successful in an academic environment and not close doors. So for example, as a junior faculty, I was more interested in my clinical education role. Maybe a little less interested in some of the scholarly activity. But once I realized how important that was to succeed in the academic arena and the opportunity to bring new information to the profession, to optometric education, to collaborate with talented people, I realized that was an important part of what we did. So learning how to be promoted at the institution, tenured if that's applicable, and how to be a successful colleague, because we hope that faculty members will remain in those roles for many years.
As I think about all the great things you've just kind of laid out for us, I hear two resounding themes. One, not to close doors, take advantage of opportunities that present themselves. And then I'd say be bold and ask for your seat at the table.
Yes.
Do you agree?
Absolutely, and thank you for articulating it that way. Absolutely. And I've always said to my students, cool, calm, and confident as they proceed, especially when they were taking procedural exams. Yes, full agreement. Not closing doors as an individual, as a faculty member, as a profession for sure. I had the opportunity to be involved in interprofessional education initiatives with SALIS, with ASCO, and there were many times when I realized our profession wasn't always at the table. And it's like what you referred to earlier about scope expansion. We need to be at the table, every table, legislative tables, professional tables, healthcare arena tables, to succeed, and so that people know who we are and what we do. So yes, being at the table for sure as an individual, as a profession, and then being bold. And by that I mean confident and not closing doors, as you've said, not necessarily in a brash way, sometimes a more subtle way. But for example, perhaps I might have been discouraged in applying for the residency if someone said to me, I don't think a woman can be a resident. And not to be discouraged by some of the bumps in the road that we all encounter, and how we navigate those bumps in the road makes all the difference as well.
Yes, I often say we misstep and we fall, it's not that we fall, it's how we get up.
Yes.
That's the important thing.
Yes, and I believe it's not if, it's when. Mm-hmm.
Yes.
Yeah, I agree.
I want to thank you so much for spending your time with us today. I want to thank Dr. Linda Casser for a great conversation today, and thank you, our audience, for your interest in the FLAM Leadership Academy podcast series.